we are looking at antimicrobial agents, that is, coinage metals and their compounds. Coinage metals are in group 11 or group 1b on the periodic table. The members include copper, and the symbol is Cu, silver, the symbol is Ag, and gold, the symbol being Au. You can just say Kau, and that is meant to help you remember the members of coinage metals. Copper and gold are the only colored metals in this category, and coinage metals are examples of transition elements, whereby we usually define transition elements as elements which have partially filled d orbitals in their atomic or ionic forms. Those three elements appear in +1 and +2 oxidation states, but when you look at gold, it can go up to +3. So the +1 and +2 compounds are actually colored, and their ions are oxidizing agents. So most compounds of coinage metals are insoluble, but you can still have soluble compounds such as copper 2 sulfate. Look at copper. So soluble copper salts have an astringent action, and both soluble and insoluble copper salts have antifungal action. So we look at copper 2 sulfate. You can see the picture there. It is also known as blue vitriol or even cupric sulfate. It has germicidal activity, and it is toxic to microorganisms such as fungi, algae, and protozoa. And therefore, during water treatment, it can be used as an algicide, but you have to use the concentration that is very low so that it does not harm humans and also fish. So copper 2 sulfate can be used as a fungicide and also as an algicide. Copper 2 sulfate has irritant, astringent, and antiseptic properties. It is used as a germicide, and it can be added to animal feed to provide copper for hematopoiesis. It can also be used as an emetic in poisoning, but it's not largely used because of it being toxic. It can cause toxicity. So copper 2 sulfate is also an active component of Fehling's and Benedict solutions, and these are used in testing for presence of reducing sugars. To silver, only silver 1 compounds are of interest in medicine, and the solutions of soluble salts are germicidal. They also have astringent, irritant, and corrosive actions depending on the concentration. Then the insoluble compounds exhibit only germicidal activity. Why? Because only small amounts of silver ions are released over time. And the silver ions precipitate both the chloride and albumin of tissue fluid, thus maintaining a continuing germicidal action because of slow release of silver ions. And the precipitating action also localizes the irritating effects of silver ions, thus widening the area of treatment. Reasons why silver compounds are not frequently used. So despite the ability of silver to exhibit GAIC, which is germicidal, astringent, irritant, and corrosive actions, they are not frequently used because of the reasons outlined below. 1, they are too poisonous. Number 2, they have cosmetic problems because of the deposition of silver metal, because the silver products are sensitive to light, and then they cause irreversible discoloration of the skin or mucous membrane, and also silver compounds are costly. We look at silver incompatibilities. So silver containing compounds are sensitive to light, and therefore they should be stored and dispensed in dark bottles, and also ensure that you only use freshly prepared solutions or suspensions. Then when in contact with mild reducing agents, you can have deposition of gray particles of silver metal. Then silver is also sensitive to moisture and water, and this can lead to tarnishing of the silver in humid environments. Then silver is also incompatible with some metals. Then silver can react with strong acids and strong bases in certain conditions. We look at silver nitrate. Silver nitrate can be prepared by reacting metallic silver with concentrated nitric acid, and that will give you silver nitrate. So among the silver compounds that are commonly used, you have silver nitrate of ophthalmic solution that is used in infants, in prophylaxis against ophthalmic neonatal. Then you have toughened silver nitrate, which is also known as caustic pencil for management of warts. Then you have ammoniacal silver nitrate solution, which is also known as Howes solution. We look at silver nitrate ophthalmic solution. It is used as 1% solution to prevent neonatal conjunctivitis, also known as ophthalmia neonatorum. Then we have toughened silver nitrate. It is also known as caustic pencil. How is it prepared? It is a combination of silver nitrate and potassium nitrate. Where is it used? It is used as a topical treatment that is applied to the skin or mucous membranes to shrink tissue or form a black extra. It can also be used in management of warts. Then we have ammoniacal silver nitrate solution, which is also known as Howes solution. It is a solution of diamine silver in excess ammonia. This solution is used in dermatological practice because of its ability to penetrate keratin. It can also be used as we look at uses of Howes solution, which is ammoniacal silver nitrate solution. It has been used for a variety of dental purposes, including caries treatment, whereby Howes solution was used to prevent and treat dental caries or cavities. Then it can also be used in root canal disinfection, whereby it is used to sterilize root canals. It is also used in treating deep caries lesions, and it can also be used in oral ulcer management, whereby silver nitrate sticks were used to manage oral ulcers. It can also be used in pain reduction, whereby the silver nitrate sticks were used to reduce pain due to aphthous stomatitis. This slide shows examples of silver preparations. We have toughened silver nitrate and also silver nitrate solution. If we look at silver proteins, they are mainly of two types: mild silver proteins and strong silver proteins. These compounds are useful germicides and are generally non-irritating. When we look at mild silver proteins, here you have the silver ions and the proteins. That can either be albumin or gelatin. The total silver content is between 19 to 23%, and the free silver, however, is low, and this compound has good germicidal action and irritation is negligible. It is a bacteriostatic agent. Note that the solution of mild silver proteins should always be prepared fresh. You can add a stabilizer such as EDTA, which is ethylene diamine tetraacetic acid, and it contains little amount of silver ions, hence less harmful effects. The uses of mild silver proteins include the solution, due to its low irritability, is normally used as a local antibacterial agent on mucous membranes in the nose, throat, and conjunctiva of the eye. This preparation is also used for irrigation of the urethra and bladder. Its major effectiveness is seen during the treatment of gonococcal infection, and it is also used in respiratory tract infections and prophylaxis against respiratory infections. Silver proteins. They are colloidal solutions of silver that have a higher concentration of silver ions compared to mild silver proteins. They have partially hydrolyzed peptone and albumose as protein stabilizers, and they contain 5 to 10% silver by weight. And then compared to mild silver proteins, the free silver ions, the concentration of free silver is high, and the germicidal action is also good. Why? Because of the high silver content. However, this can be irritating. Hence, when you're choosing the concentration, you have to ensure that it is low. So for mild and strong silver proteins, the mild silver proteins have higher concentration of silver, but it is less subject to ionization. So that is why we are saying yes, the silver concentration is high, but when it comes to the free silver, it is actually low. So the action depends on slow release of silver ions from the insoluble compound, and both agents are useful antibacterial agents. So mild silver protein solutions are used in rhinitis, conjunctivitis, and also tonsillitis. Then the strong ones are preserved for wounds. How can we remove silver stains? So you can get silver stains due to deposition of finely divided black particles of metallic silver. And this could be due to light and also presence of reducing agents. So if you want to remove silver from the skin, you can treat the skin with tincture of iodine, leave it to dry, and then you paint the area with sodium thiosulfate solution. You can repeat the procedure several times. Then the silver stains may be removed from the clothing by use of cyanide solution, but remember that cyanide is very, very toxic, so that process should be done by individuals who are actually keen on their safety. They know safe handling of this dangerously poisonous substance. Then you can use ammonia to remove stains from the clothes. You can also use hydrogen peroxide to remove stains from light colored fabric, and you can also use lemon juice or vinegar to rinse the skin. Then we have gold. Gold is used as a drug carrier, whereby gold nanoparticles can be functionalized with antibodies or peptides to target specific cells or organs. And then gold is also useful when it comes to treating rheumatoid arthritis. And then gold is also used in photothermal therapy, whereby gold nanoparticles have many potential uses in photothermal therapy. Look at sample questions. Question number 1. Outline the uses of gold in medicine. Question number 2. State why silver compounds are not frequently used. Question number 3. Outline the uses of the following silver compounds, that is silver sulfadiazine, caustic pencil, 1% silver nitrate solution, and Howes solution. Number 4, briefly discuss silver incompatibilities. And then number 5, outline the uses of copper 2 sulfate. Thank you.